Yeah, hello, our students. Hello, how are you? I hope you are all well. I am doing well, and I am happy to again meet you today to discuss occupational health and safety practices. And today we shall be looking at the implementation of occupational safety and health programs, procedures, policies, and guidelines. And then at the very end of the presentation, we shall also discuss a little bit on risk assessment. I have attached two topics together in the interest of time and also to make it easier on my side. As we mentioned earlier, you have to remember that occupational health and safety practices are very important practices at the workplace, and the purpose is to ensure that we give guidance or we guide people accordingly so that we prevent injuries, we prevent situations that can occur at the workplace related to hazards and risks. And we say the hazard is anything that has potential to cause harm, and the risk is the probability of the hazard of somebody being injured or somebody sustaining serious injuries based on the hazard that is existing. So you have to remember those symbol basics as we move, symbol basic terms as we move ahead. I am going to go straight to the first slide where we say standard operating procedures. Every organization has got standard operating procedures. A standard operating procedure is a step-by-step instructions compiled by an organization to help workers carry out routine operations. SOPs aim to achieve efficiency, quality, output, and uniformity of performance while reducing miscommunication and failure to comply with industry regulations. Implementation of occupational safety and health programs, procedures, policies, guidelines, as well as the occupational health related records is based on the workplace procedures. Every workplace has got a different standard operating procedures, depending on the kind of operations and depending on the objectives and the goals of the organization. So companies are different, operations are different. For example, how Safaricom operates and how Kenya Airways operates, it is totally different. Each organization has its own standard operating procedures. How Village Market Complex operates and how Sarit Center operates, completely different. They are all shopping centers, shopping malls, but their operations are different in every way. However, there are other standard operating procedures that are common to all working places, and we shall be looking at this as we move along. So just take it that standard operating procedures exist at every organization to guide employees on how they should be done step by step, how work should be done step by step. The contents of standard operating procedure. The standard operating procedures have the title of the procedure, for example, access control. They have a standard operating procedure identification number. They have a publication date or revision date, the name, the role, organization, division, or agency that the SOP applies to, names and signatures of those who prepared and approved the procedures outlined in the standard operating procedure. When you grow up in your career, when you become a manager, you will be tasked with compiling standard operating procedures. It is a very interesting field. It is a very interesting field, especially for us who are in the security industry. If you talk to many people, find it a very big challenge to compile standard operating procedures. However, for those of us who have been in the field for quite some time now, we have developed or we have mastered how to do this. Sometimes organizations hire us on consultancy basis to prepare standard operating procedures. Definition of key terms. Occupational safety and health procedures and policies. They are guidelines used to direct all employees to work safely and prevent injury to themselves and others. That is self-explanatory. Occupational safety and health standards. Occupational health and safety standards are rules that describe the method that employees must use to protect their employees from hazards. Rules and methods that employers must use to protect their employees from hazards. For example, one rule is that each and every employer will ensure there are adequate personal protective equipment for use at the workplace. That is the responsibility of the employer. And when it comes to the employee, it starts with you must use standard personal protective equipment provided to you by the employer, failure to which you will face serious consequences or disciplinary actions. Therefore, these standards limit the number of hazards workers can be exposed to, require the use of certain safe practices and equipment, and require employers to monitor hazards and keep records of workplace injuries and illness. We said in the other presentations that this is mainly the responsibility of the security department working hand in hand with the HR department to monitor hazards and keep records of workplace injuries and illness. It is the responsibility of the security department to do these things. We say occupational safety and health related records. What are some of the records? These are documentations that keep track on various occupational safety and health processes. There are 7 core elements of an effective safety and health program. 7 core elements of an effective safety and health program. And this element number 1 is management commitment. Element number 2 is employee involvement. Element number 3 is hazard identification and assessment. Element number 4 is hazard prevention and control. Element number 5 is education and training programs. Element number 6 is evaluation and improvement. And element number 7 is management of contractors and staffed employees. Please note something down there. I take a glass of water. You note something down there, please. Our discussion today will mainly revolve around these 7 core elements of an effective safety and health program. Management commitment, employee involvement, hazard identification and assessment, hazard prevention and control, education and training programs, evaluation and improvement, and management of contractors and staffed employees. Implementation. Information to work team about company occupational safety and health program procedures, policies, guidelines are provided. They must be provided by the employers. Implementation of occupational safety and health procedures and policies and guidelines are participated, which means employees must participate. Then team members are trained and advised on occupational safety and health standards and procedures. Procedures for maintaining occupational safety and health related records are implemented. They must be implemented. It is a responsibility for you as the security leader to implement these policies and records and procedures. Information to work team. Information to work team about company occupational safety and health program procedures and guidelines are provided. The purpose of the health and safety policies and procedures is to guide and direct all employees to work safely and prevent injury to themselves and others. All employees are encouraged to participate in developing, implementing, and enforcing health and safety policies and procedures. All employees are encouraged to participate in developing, implementing, and enforcing health and safety policies and procedures. That is why we usually have a health and safety committee at the workplace, comprising of nominated members from each department: finance, security, engineering, front office. These people come together and then they participate in developing and implementing and enforcing health and safety policies and procedures. And not only the committee, even the employees themselves have a responsibility. We earlier on looked at responsibilities of employers and responsibilities of employees under the Act. And we said, number 1, responsibility of an employee is to ensure their own safety and safety of others at the workplace, to consider the actions they take and the omissions, what they do not do, and to ensure that these things do not bring insecurity issues or occupational health and safety issues. The following occupational safety and health programs can be considered. 1, medical surveillance. This is a planned plan of periodic examination, which may include the following: biological effect monitoring, clinical examination, etc. And then we have two, periodic occupational health surveillance. This consists of examination conducted periodically to identify vulnerable groups among the staff, which would be of immense value to prevention. And then number three, management of occupational exposure. This means amount of workplace agent that has reached an individual worker. Management of occupational exposure. This means that we must watch the level that people are exposed to risks or not to hazards. We must watch the level of people, the level that people are exposed to hazards, and this can be done easily through risk assessment that we shall see later on. And then we say implementation of occupational health safety procedures and guidelines. Implementation of these procedures and guidelines are conducted through one, conducting workplace audits and risk assessments at facility level, overseeing compliance of facility design and building codes for new construction, and then support the procurement systems for quality and adequate personal protective equipment and other occupational safety and health supply within the facility, and then review causes for rehabilitation and compensation of injuries and health and to employees. Employees must be compensated under international law for labor. There is a requirement that if you are injured at the workplace, you must be compensated. Even at our level in Kenya, if you are injured at the workplace, you must be compensated. However, unfortunately, most employers try to run away from this responsibility, so it ends up in the courts, and then mostly if the company is found to be at fault, then definitely the company will be ordered by court to compensate someone. And you have had these cases. You have had these cases a lot. You have had these cases a lot where somebody is injured, seriously injured, and they are unable to continue in employment. And then the company refuses to pay. And then the matter goes to court. And then the court rules after many years that this person should be awarded. We also say the management of incidences and emergencies arising within the health facility, ensuring new staff go through the induction and orientation on occupational safety and health issues. This is one failure where most companies do not bother to do an induction and orientation on occupational safety and health. And you, as a security professional, you can add value here by encouraging the HR that when we have new employees, after every 2 months or after every 1 month, they must bring them together under security, and I will take them through an induction. And then you prepare a program for occupational health and safety. You sit them down, you talk to them, you tell them the risk, you tell them the requirements, the regulations, that you must wear personal protective equipment. If I find you within the company without personal protective equipment while on duty, definitely you will face the consequences. You must abide by occupational safety and health standards and requirements. You must participate in these programs. You must participate in trainings. You must participate in briefings. You must know what to do in the event of an injury. You must know issues related to first aid. You must know issues related to fire safety. This is one area that security managers or security leaders can add value in the company and also to yourself. And then induction and orientation note is very important. Publicizing, promoting, and enforcing the guidelines and the procedures among staff they supervise. Then employers also have to coordinate capacity building of the facility level staff and disseminate policy guidelines at the facility level. You see, responsibility comes to the security manager and also the occupational safety and health committee. As we continue, we see that training and advice on occupational safety and health. Effective training and education can be provided outside a formal classroom setting Peer-to-peer training, on-the-job training, and worksite demonstrations can be effective in conveying safety concepts, ensuring understanding of hazards and their controls, and promoting good work practices. Another area to add value as a security officer or security manager. I keep telling security managers, we had a webinar the other day when we were talking about the effective security manager, and we mentioned adding value is one of the areas that is very important. Add value through trainings. Don't just stay in the office. You think that you are comfortable in the job. Add value, add value, add value. Conduct trainings, conduct occupational safety and health trainings, conduct internal fire safety training, teach people how to use fire equipment, teach people how to wear personal protective equipment, teach people the importance of these equipments. You will be adding value and your work will be very effective, and the management will be happy with you, and you will be promoted, and you will be considered for so many things. So security professionals add value even in other fields. If you are in IT field, if you are in another area, human resources, strive to add value at your workplace. Then you must also understand your rights. The legislation gives employees 3 rights. The right to know the hazards at work and how to control them. You remember we spoke about the legislation, which is the Occupational Safety and Health Act 2007. The right to participate in occupational health and safety, and then the right to refuse work, which they believe to be usually dangerous. Employees may not be punished for using these rights. An employer can be required to legally justify any action taken against a worker who is active in health and safety. So 3 rights, your rights. You may also need to write them down, your rights. And then also you have a right to know, your right to know. The standards require employers to provide employees with all the information needed to control the hazards they face at work. For example, chemicals at the workplace must be listed. Employees are entitled to review this list. The employer must train employees to safely handle the chemicals they work with. Inexperienced employees must receive an orientation. Another area also to add value is to ensure that this information is passed to employees. And then right to participate. Employees have the right to become involved in occupational health and safety. The legislation encourages employers and workers to work together to maintain a healthy and safe workplace. Employers of workplaces with 10 or more people, workers, must set up an occupational health and safety committee. You remember we mentioned about the committee with the representatives from each department. Then the right to refuse. You have a right to refuse. Employees have the right to refuse to do work which they believe is unusually dangerous. The unusual danger may be to one employee or to anyone else. So you have a right to refuse. You cannot be forced to do work that you believe is dangerous. For example, your employer asking you to handle corrosive chemicals without proper personal protective equipment is something that you can outright refuse. Then we talk about maintaining occupational health and occupational safety and health related records. Maintaining occupational safety and health related records. The occupational health and related documentations may include accident reporting. This includes investigation and analyzing incidences, underlining deficiency and renew incident reports. Then reporting also recording of dangerous occurrences. The Occupational Safety and Health Committee shall maintain a register for such occurrences in the format given in the occupational health regulations. And then incident and near misses. The workers shall report any accident and near miss within the work area. The Occupational Health and Safety Committee shall maintain a register and the occurrence should be investigated. And then notifiable diseases. The Occupational Health and Safety Committee shall maintain a register of occupational diseases that has been reported. So they must be registered. And remember, in this age, don't only keep these records on the systems. Keep also manual records. Systems collapse and you lose information. You need to have backups. So always record this thing. That is why the occurrence book will remain an important operational item, both in security and even in other departments at the workplaces. We shall never, no matter how automated we become, we are never going to get rid of the occurrence book, because it is a very nice backup for accident reporting, for dangerous occurrences reporting, for incident and near miss reporting, and for notifiable diseases reporting. Also, risk assessment in occupational safety and health. What is the risk assessment in occupational health and safety? We said earlier, what is a hazard? A hazard is the potential for harm. In practical terms, a hazard often is associated with a condition or activity that, if left uncontrolled, can result in an injury or illness. Identifying hazards and eliminating or controlling them as early as possible will help prevent injuries and illnesses. Then, risk assessment, the overall process of hazard identification, risk analysis, and risk evaluation. That is the purpose of the meaning of risk assessment. You can also note something down there. Then there is hazard identification, the process of finding, listing, and characterizing hazards. And then there is risk analysis, a process of comprehending the nature of hazards and determining their level of risk. Can you please write something down there? And then also we have other definitions. We'll say that risk analysis provides a basis for risk evaluation and decisions about risk control. Information can include current and historical data, theoretical analysis, informed opinions, and the concerns of stakeholders. Risk analysis includes risk estimation. These terms, you should know them. As a professional in your field, you should be familiar with these terms. Risk evaluation is the process of comparing an estimated risk against given risk criteria to determine the significance of the risk. And then we have risk control, actions taken in implementing risk evaluation decisions. And then note, risk control can involve monitoring, re-evaluation, and compliance with decisions. You should be familiar with those terms as relates to occupational safety and health. Then we look at job hazard analysis. Risk assessment in this course will be discussed in the context of a job hazard analysis. And what is a job hazard analysis? A job hazard analysis is a technique that focuses on job tasks as a way to identify hazards before they occur. It focuses on the relationship between the worker, the task, the tools, and the work environment. Ideally, after you identify and control hazards, you will take steps to eliminate or reduce them to acceptable risk levels. The importance of a job hazard analysis. Many workers are injured and killed at the workplace. Safety and health can add value to business, jobs, and life. Help prevent workplace injuries and illness by looking at workplace operations, establishing proper job procedures, and ensuring that all employees are trained properly. One of the best ways to determine and establish proper work procedures is to conduct a job hazard analysis. A job hazard analysis is one component of the larger commitment of a safety and health management system. So a job hazard analysis is very important, and you should learn how to conduct it briefly, and we shall look at that in brief. The value of a job hazard analysis. Supervisors can use the findings of a job hazard analysis to eliminate and prevent hazards in the workplaces. This is likely to result in fewer work injuries and illness, safer, more effective work methods, reduced workers' compensation costs, and increased worker productivity. The analysis also can be a valuable tool for training new employees in the steps required to perform their jobs safely. For a job hazard analysis to be effective, management must demonstrate its commitment to safety and health and follow through to correct and any uncontrolled hazards identified. Otherwise, management will lose credibility and employees may hesitate to go to management when dangerous conditions threaten them. What jobs are appropriate for a job hazard analysis? A job hazard analysis can be conducted on many jobs at the workplace. Priority should be given to the following types of jobs. Jobs with the highest injury or illness rates, jobs with the potential to cause severe or disabling injuries or illness, even if there is no history of previous accidents, and then jobs in which one simple human error could lead to a severe accident or injury, and then jobs that are new to the operation or have undergone changes in the process and procedures, and jobs that are complex enough to require written instructions. Those are some of the jobs that may need a job hazard analysis. And then the steps for a job hazard analysis process. The steps. Step 1, involve employees. It is very important to involve employees in the hazard analysis process. They have a unique understanding of the job, and this knowledge is invaluable for finding hazards. Involving employees will help minimize oversights, ensure a quality analysis, and get workers to buy into the solutions because they will share ownership in their safety and health programs. So involve employees. That is number 1. Step number 2, review accident history. You can only review accident history if you have records. That is why we said records are very important. Review with employees workers' history of accidents and occupational illness that needed treatment, losses that required repair or replacement, and near misses, events in which an accident or loss did not occur but could have. These events are indicators that the existing hazard controls, if any, may not be adequate and deserve more scrutiny. So step number 2 is to review accident history. Step number 3 is to conduct a preliminary job review. Discuss with the employees the hazards they know exist in their current work and surroundings. Brainstorm with them for ideas to eliminate or control those hazards. If any hazards exist that pose an immediate danger to an employee's life or health, take immediate action to protect their work. Any problems that can be corrected easily should be corrected as soon as possible. Do not wait to complete job hazard analysis. This will demonstrate commitment to safety and health and enable you to focus on the hazards and jobs that need more study because of their complexity. For those hazards determined to present unacceptable risks, evaluate types of hazard controls. Those hazards determined to present unacceptable risk, evaluate types of hazard controls. And then step number 4, list, rank, and set priorities for hazardous jobs. List jobs with hazards that present unacceptable risks based on those most likely to occur and with the most severe consequences. These jobs should be given first priority for analysis. Step number 5, outline the steps or tasks. Nearly every job can be broken down into job tasks or steps. When beginning a job hazard analysis, watch the employee perform the job and list each step as the worker takes it. Be sure to record enough information to describe each job action without getting overly detailed. Avoid making the breakdown of steps so detailed that it becomes unnecessarily long or so broad that it does not include basic steps. Then you may find it valuable to get input from other workers who have performed the same job. So step number 5 is to outline the steps and tasks needed to do a particular job. We are conducting a job hazard analysis, and then later Review the job steps with the employee to make sure you have not omitted something. Point out that you are evaluating the job itself, not the employee's job performance. Include the employee in all phases of analysis, from reviewing the job steps and procedures to discussing uncontrolled hazards and recommended solutions. Sometimes, in conducting a job hazard analysis, it may be helpful to photograph or videotape the worker performing the job. These visual records can be handy references when doing a more detailed analysis of the work. And then moving on, how to identify workplace hazards. We already did this in the identification of hazards. We already did this under lesson 2. A job hazard analysis is an exercise in detective work. Your goal is to discover the following: what can go wrong? What are the consequences? How could it arise? What are other contributing factors? How likely is it that the hazard will occur? To make your job hazard analysis useful, document the answers to these questions in a consistent manner. Describing a hazard in its way helps to ensure that your efforts to eliminate the hazard and implement hazard controls help target the most important contributors to the hazard. And then also we say a good hazard scenarios describe where it is happening, which is the environment, who or what is happening, to is the exposure, what precipitates the hazard, what is the trigger, and then the outcome that would occur should it happen, consequences, and any other contributing factors. These are some of the things to consider in a good hazard scenarios. And then also briefly, I would like to mention something on an adverse health effect. A definition of adverse health effect is any change in body function or the structure of the cells that can lead to disease or health problems. Adverse health effects include bodily injury or disease, change in the way the body functions, grows, or develops, effects on a developing fetus, etc., effects on children, grandchildren, etc., and then disease in lifespan, and change in the mental condition resulting from stress, traumatic experiences, exposure to solvents, and so on, and then effects on the ability to accommodate additional stress. So this is what we call adverse health effect. Adverse health effect mainly deals with bodily injury or diseases that you are affected in a very serious way that you cannot continue properly in life or in operation. And then again, we go back to what is a risk assessment. In definition, a risk assessment is a term used to describe the overall process or a method where you identify hazards and risk factors that have the potential to cause harm or hazard identification. Then analyze and evaluate the risk associated with that hazard, and then determine appropriate ways to eliminate the hazard or control the risk when the hazard cannot be eliminated. This is what we call risk control. Risk can either be eliminated, it can either be transferred to insurance, it can also be accepted. You can accept risk that there is nothing we are going to do about it. We have to accept this one and move on. And then it can also be controlled. Those are ways of eliminating or ways of handling risk or hazards. Then a risk assessment is a thorough look at your workplace to identify those things, situations, processes, etc. that may cause harm, particularly to people. After identification is made, you analyze and evaluate how likely and severe the risk is. When the determination is made, you can next decide what measures should be in place to effectively eliminate or control the harm from the beginning. So you see, it is a process from identification to analysis to discovering that this could be a problem, and then to putting in place control measures to avoid injuries or accidents from happening. Then also we say risk is expressed as the likelihood or probability that harm will occur. due to presence of a hazard, and the severity of the harm will be determined by the magnitude of the occurrence. Risk is equals to hazard severity times likelihood of occurrence. Please take note of that risk is equivalent or equals to hazard, severity, and likelihood of occurrence. We can see the process of risk assessment. We say reactive monitoring, risk control, review, active monitoring, inspection and correction action, and then all other areas that are important, including investigation and corrective actions. These are some of the elements or the processes involved in risk assessment: active monitoring, inspection and correction action, review, and then investigation and corrective actions, and then reactive monitoring. Reactive monitoring means you are now reacting to a situation that has already occurred. Then we say also that those are some of the areas that we talk about: health and safety procedures. And then conclusion: in summary, this learning outcome addressed aspects to do with occupational health and safety programs, policies, standards, and related occupational health records as applicable to workplace, and also it addressed risk assessment. You have to remember the steps. If I ask you tomorrow, detail the steps in risk assessment or in job hazard analysis, then you must start with number one, involve employees. Number two, you have to follow them until you reach the last stage. So those stages are very important for you to understand. They are relevant to job hazard analysis and also risk assessment. We have come to the end of this presentation, and it is my hope that you have learned something from it. If you want more information, you can let me know through my email address, which is maganiwayne@yahoo.com. Maganiwayne, MAGANI @yahoo.com. Maganiwayne, MAGANIWAYNE @yahoo.com. So thank you very much for listening to me. We will continue with the next presentation at a later stage. So thank you and bye-bye.